New York State, the epicenter of the COVID-19 outbreak in the U.S., is seeing a surge in new cases as testing expands. By about noon Wednesday local time, more than 30,000 people had tested positive. That's roughly half of all confirmed cases across the U.S.
We have 10 times the problem that the next state has, which is New Jersey. You compare us to California, which is larger in terms of population. We have 15 times the problem.
In his daily news conference, that's become a widely viewed pandemic update in the U.S. and beyond, New York's Governor Andrew Cuomo announced new steps his state is taking to battle the crisis, including closing some streets to cars to give pedestrians more room to walk at a safe distance from each other. He's also asking New Yorkers to stop playing contact sports.
No basketball, for example. You cannot do it. We're asking people to do that on a voluntary basis. If there is non-compliance with that, we will then make it mandatory and we will actually close the playgrounds.
The alarming spread of the virus in New York City prompting a warning from the White House task force Tuesday.
Everybody who was in New York should be self-quarantining for the next 14 days to ensure that the virus doesn't spread to others, no matter where they have gone, whether it's Florida, North Carolina, or out to far reaches of Long Island. We are starting to see new cases across Long Island that suggest people have left the city.
A glimmer of hope, though. Cuomo says there are early signs that New York's social distancing measures appear to be working, with the rate of hospitalizations slowing in recent days.
Now, that is almost too good to be true. But the theory is, given the density that we're dealing with, it spreads very quickly. But if you reduce the density, you can reduce the spread very quickly.
Still, though, New York needs more hospital beds to handle the influx of coronavirus patients, and major projects are now underway to expand capacity. Workers will be transforming the Javits Convention Center in Manhattan into a temporary hospital. As many as 2,000 patients could be treated here. New York's governor says the hope is to have construction done in about a week to 10 days. For City News, I'm Melissa Duggan.